So now it's a pleasure for me to introduce you to Dieter Wiek, who is the chair of the EULAR Standing Committee of PARE, and he will give you the patient perspectives on treatment pathways across borders.
Yes, thank you very much. I'd like to welcome you all, especially it's nice to see so many PARE members, so many PARE representatives who have managed to come here. Lots of these points that were just mentioned will come up again. We, PARE, wanted to find out what experiences our PARE member organizations have made with this new legislation. And I will outline briefly the method, the background of this survey, some key results, and, well, the conclusions that can be drawn. I think we heard that several times before. I will not enlarge on the numbers here. You see that number one cause is disability. I think we patients know quite well there are lots of other impacts. In 2013, I had the opportunity to go to an EPF regional conference, and I remember we were rather enthusiastic at the beginning when we heard about cross-border healthcare, about the potential benefits. And in particular, those with rare diseases saw this as a great opportunity. I must say that at the end of the conference, we were somehow disillusioned because we saw what kind of difficulties would come up. Well, with this study, we wanted to find out what experiences our member organizations have made with this legislation and what they think of that. The background, the purpose. As I said before, 30 of our 36 organizations took part in that questionnaire so that we could collect information on the implementation of cross-border healthcare. In our survey, we really concentrated on RMD-related medical treatment, so not on other illnesses or conditions, only pre-planned treatments, so not unexpected or emergency treatments. And finally, only treatments that patients received in the last 3 years. We are aware of the fact that it is just a snapshot. It can't be compared with to what we heard before. But I think it reflects also other reports, for example, that of the European Commission. It was already mentioned before. I think it would be very interesting to find out how people of our RMD community, that means patients, really have experienced and see this legislation. But I think this can only be done by us later. So we intended to find out what our member organizations know about cross-border healthcare, where their members get their information support from, what the organizations can tell about pre-authorization and reimbursement, quality and safety, and finally, how they see this legislation. So what are some of the key results? Only a very low number of our organizations were asked for information. According to our member organizations, only few patients were seeking treatment abroad. These results, I think, very much correspond to the barometer 2015, where it is said that 5% had used healthcare abroad, 2% had pre-planned treatments. I think even less were aware of the administration processes. The biggest group of patients seeking cross-border healthcare had IA, followed by lupus, osteoarthritis, AS, and rare diseases. Measures relating to surgery and rehabilitation are by far the most treatments sought abroad. Half of these treatments relate to RA alone. I think this trend reflects the shortfalls in surgical treatment, which PARE members report as by far the greatest deficiency in domestic medical service provision, and what is the reason for patients to request medical services abroad. Rehabilitation measures are also often unavailable. Another major reason for patients to request services abroad are excessive waiting times. Well, what barriers are there? Well, if you look at the non-financial obstacles, the insufficient information is cause number one. There are others as well, like administration or quality concerns. Strikingly, the financial burden of receiving treatment abroad, also in terms of unclear reimbursement procedures, is the largest deterrent for patients to make use of their rights. Well, where do patients get their information from? The national contact points are information source number one, followed by national governments' websites. It's a pity, but we must accept it. Only 11 PARE organizations provide information on cross-border health care. 8 organizations did not give any answer at all. So we do admit there's room for improvement, as I think patient organizations can fill that gap. But to my mind, there's also the question, is there more than giving information? Can they also accompany patients, for example, on their way through that system? How do our members rate the information given by national contact points? Well, PARE members gave poor ratings to the information services provided by national contact points, although this is by far the leading information source for patients. I think the Eurobarometer says that less than 2 out of 10 feel they are informed. If we consider how the information and support sources are rated as a whole, we see that only a very low number regards the quality of information as sufficient, and a very high number believes it is insufficient or very insufficient. Pre-authorization and reimbursement. Well, this process, I think that's what we heard this morning, varies greatly among EU countries, allowing for a very limited comparability. However, what we saw is that all PARE members deplored a lack of clarity and reimbursement under their national social security systems. This is also an issue that is brought to them by patients, as there is widespread uncertainty about which treatments are eligible for reimbursement. Well, quality and safety. Well, we must admit there were no issues reported when patients received treatment, and the data were not valid, so we can't say very much about that. The new legislation is largely viewed as an advancement, but people are not able to reap the benefits, to see the benefits, and make use of their rights due to the various barriers, as I mentioned before. The implementation of this legislation is seen really critically. This is, I think, very worrisome, since numerous organizations have recognized an increasing interest by patients in requesting treatment abroad. It was very nice. Lots of our member organizations wrote very detailed, comprehensive comments. We just selected 4, but the direction of these comments is always very similar. It was mainly criticized that there is a lack of information, a deficit concerning transparency and administration processes. So, what can we conclude? There is a low awareness of the possibility to receive treatment abroad. The information is not sufficient. This has to be improved. If patients would like to use cross-border healthcare, the financial burden means the biggest obstacle. There are direct costs, but also that's what we heard this morning, there are lots of indirect costs for patients. There's a lack of clarity and transparency about the rules of authorization and reimbursement. The legislation itself is seen very positively, but the improvement focus has to lie on implementation, more practical help, and support for patients. Exploration of common guidelines for national contact points might be a way forward. I think this is said in the European Commission report. A survey directed towards RMD patients to find out more about their cross-border experience would be helpful. And finally, it would be good to have policy recommendations based on these survey results and the results of this conference, and I'm sure the workshop we're doing this afternoon that is will be helpful and will contribute to this, to develop these recommendations. Thank you very much.